Hello and welcome second year dental students in the oral histology practical course. Today we are going to discuss the enamel under microscope to see the histological features and phenomena we can see in this tissue under microscope. I am Dr. Hibalzer and I will be your instructor for this subject. First of all, we are going to give you the outline of the session, so you'll be guided through it. We are going to talk about enamel. How are we going to see enamel under microscope, in which kind of section, the ground or the demineralized section? And then we are going to discuss the building unit of enamel, which is called rods. Afterwards, we are going to take different sections of enamel and describe and discuss all the phenomena and features that we can see under the microscope. These are the phenomena that we usually see under microscope: the gnarled enamel, the Hunter-Schrager bands, dentino-enamel junction, spindles, tufts, lamella. The gnarled enamel and the Hunter-Schrager bands are a result of the wavy course of the rods. The spindles, tufts, and lamella are features that we can see on the dentino-enamel junction. Afterwards, we are going to the bulk of the enamel and see the striations that occurs as a result of the resting and activation secretion of enamel during the Ameloblast secretion of enamel. These are called cross striation and enamel stria or stria of Ritzius. One of them is called the neonatal line. And finally, we are going to see the enamel surface and all the features that we can see on the enamel surface, including the interface of enamel with cementum that is called cemento-enamel junction. Kindly go to the theoretical course, as this practical course depends fully on all the theoretical information that you have learned in the theoretical part. So please, if you are not familiar with these terms, or you feel that you need some information to understand the practical session, go back and see the theoretical lecture. So we talked about enamel in the theoretical part, and we explained that enamel is a highly mineralized tissue that is composed of 96% in organic material, which means we can see enamel in ground section, as we can see here. This is the enamel covering the bulk of the hard tissue that forms the bulk of the tooth, which is the dentine. And in the demineralized section, we see a space, we call it enamel space, where the enamel should actually rest. In this section too, it's a ground section, we can see the enamel. You can see that enamel is really thin compared to the dentine below. It is thinnest on the cervical margin here, and the thickest under the cusps and on the occlusal surface. In this demineralized section, we can see only the enamel space. We can see the enamel in demineralized section only in one situation, is when the enamel is not mature yet. You will discuss that in the embryology lectures. The enamel starts as an organic gel matrix that mineralize afterwards. That's why if it's not still mineralized, we can see it in demineralized sections. This is a histological section, shows us the white enamel surface of the tooth covering the yellow dentine beneath. There is a junction between them, it's called dentino-enamel junction. This enamel, this beautiful enamel, is composed of a building block or a building unit. It's called enamel rod. Enamel rods usually take this keyhole shape and is composed of millions and millions of crystals, which are represented here as dots inside the rods. Millions of them stack over each other to form this beautiful keyhole rod. Why does the crystals arrange in keyhole shape? You can see the next video at the end of this this part. This is part 1, and I left 2 videos afterwards in the interactive book. You can look at these 2 videos to understand how these keyhole shapes are formed and why it's a keyhole shape and not any other shape. So anyway, this keyhole shape, it's a head and a tail. And as you can see, each tail has two heads beside it. And it's composed of these millions of crystals stacked over each other. As you can see in this image, the proteins called amelogenins, we talked about them in the lecture, make some kind of grouping with a lot of other ions and other proteins to make fibrils and fibers that come together to make the rods that actually mineralize afterwards and make the enamel. These are the crystals that we saw as dots in the keyhole shape. They are hexagonal. These are crystals. They contain many hydroxyapatite molecules because we said that the inorganic material of the enamel is hydroxyapatite. As you can see, this is the keyhole shape, the rod head and tail, the crystals stacking inside. Also in this section, there's the head and the tail, the head and the tail, and a lot of crystals actually stacking inside the rod. Also here, head and tail, and a lot of crystals in the head. You can notice that the crystals doesn't have the same angles all over the head and the tail. So the crystals are with the long axis in the head core, but on the sides they deviate, and also in the tail. I will show you that in another slide in a few minutes. These rods come together they walk in lines from the dentino-enamel junction into the enamel surface. And they have different direction in the anterior or posterior teeth and in different parts of the tooth. As you can see here is the adult tooth, here is the deciduous tooth. In the adult tooth, these rods go horizontally or, apically in the adult tooth, horizontally in the middle, and vertical under the incisal edge. While in the deciduous teeth, they are horizontal in the cervical area. Why are these information very important? Because when you prepare the tooth, when you prepare the enamel to receive a restoration, you have to remember the angle of these rods in the enamel in order not to break the enamel or damage your restoration or make it help in failure of restoration in the future. That will be discussed again for you when you start to make restorations in the third year. Also in the molars, as you can see, the direction of the rods is different. It's horizontal in the cervical area in posterior teeth, in adult posterior teeth, while in the deciduous teeth, they are going actually toward the occlusal surface. Keep this in mind and remember this slide when you start to make restorations in the third year. If we take a section of enamel anywhere, we're gonna see the keyhole pattern I just have explained. But according to the angle we are cutting in, as you can see here, if we are cutting in a vertical 90 degrees angle, we're gonna see the perfect keyhole shape. Imagine that you have a cucumber and you are cutting it with a knife. Each time you deviate the knife into an angle, you're gonna have a wider circle. That's actually what happens here. The more the angle is going to be obtuse, the more the circular shape and widened shape of the keyhole is gonna be seen. Usually, most of the time, when we have sections, when we have histological sections, we have mostly 4 patterns to see. 4 patterns mainly are seen: the keyhole shape, as we can see in A, the circular shape, as we can see in B, the stacked arches, and I think the name explains itself, and the irregular, which are seen usually near the dentino-enamel junction. As you can see in this image or photo, that the crystals are with the long axis of the rods in the head, in the core of the head, but in the tail they start to deviate, and also at the periphery or at the edges of the head also the crystals start to deviate. This deviation gives us a difference in color between the edges of the keyhole pattern and the core of it. And we can see this in a lot of sections, longitudinal or across, always the sheath or the layer of the exterior of the keyhole is darker or distinguished than the core of the head and the tail. We will see that in a minute. As you can see here, the boundaries of the shape is distinct because of the crystal's deviation. We can see here a keyhole, for example. Here we can see stacked arches. Here we can see the circular pattern, and as you can see, the boundaries are well defined because the crystals deviate at the boundaries of the head and the tail. More and more, the deviation gives us a clear boundary of the keyhole or of the pattern that's seen in the section. If the enamel rods are cut in longitudinally, you can see it as long passages like this. These are longitudinally cut enamel rods. Imagine that you have a spaghetti, one spaghetti in your hand, and you cut it in half. That's what you are gonna see. It's like a long passage. But if it's cut in cross section, you're gonna see the keyhole pattern, the circular, or the other two patterns we have discussed. As I have said, always you're gonna see the rod sheath covering the rod core. The rod core very defined, and the tail also is gonna be defined because the direction of the crystals changes. Between the rods, this deviation in crystals, which is really seen here in this electron microscope image, as you can see how the crystals deviate between the rods, which is called the interrod. Another picture. Of course, in these last few pictures, it's almost impossible to know that we are now in enamel. So if I am going to give you or examine you with such images or slides, I'll always give you a hint that this tissue is enamel before I'm going to ask you any question about it. So as you can see, the tail and the body has different direction of crystals. That's why one of them is darker than the other. And here the same issue. Something that you're gonna see in the following video is how the ameloblasts have a wavy course of enamel secretion. So the rods does not actually walk in straight lines upon secretion. Ameloblast, actually, this is an ameloblast, it secretes enamel in this direction and move in the other direction. And while it moves in the other direction, it is the enamel surface direction because the ameloblasts finish their task on the surface and then they die. But in that time, while they are secrete the enamel going to the exterior of the tooth, they don't go in straight lines like this. They actually walk in wavy courses. So they create these wavy rod courses. Why is that? Because this wavy course helps to make what we call prisms. Prisms are a group of rods that together, like if these 15 rod together, all these 15 walk in the same wavy course. Together they make something called a prism. This prism mechanism or a prism arrangement of the enamel strengthen the enamel, and we discussed that also in the lecture. As you can see here, the this wavy courses of the rods. That will be really clear for you when you see the next two videos I'm gonna upload for you. This is the end of part 1, and next we are going to talk about the features we see in enamel because of this wavy course of enamel rods during secretion. See you in next part.